Hi, I'm Molly, the student nurse. I'm going to be accessing your port today so we can get a blood sample later. Can I have you verify your name and date of birth? Okay, great. And any allergies? Okay, so I'm going to go ahead. Too much on. Let's clean our bedside table. We're going to be setting up a sterile field. Good, and give that a chance to dry. Sanitize and gloves. Okay, and how is the site feeling? Do you have any pain or tenderness at the port site? No? Okay, great. So I'm looking here, I don't see any redness or swelling. I'm feeling it's not warm, not inflamed, swollen. Good, and you said it feels good. Okay. Then we'll go ahead and I'm gonna put on new gloves. And then we'll set up our sterile fields. And when I was feeling the port, I did feel it is not a power port. That would have 3 dots in a triangular shape. It did not have that. Okay. So first thing I want to do is I have my Huber needle. It's very important. We have to have a Huber needle to access the port. It's a non-pouring needle. So we're going to flush this with trying to keep it as sterile as possible with my already primed normal saline syringe. Okay. Go ahead and set that down. I checked the expiration on my kit. It is good. So on top I have my sterile gloves and my bio patch. I'm actually just going to set that aside for right now. I have the mask for my client. I would put that on the client if they were unable to wear it. I would have them turn their head once I clean the site so they're not contaminating or breathing on the clean site. And then I have my mask on already, so we're going to go there. Go ahead. Throw that away. All right, and then we're going to open the kit. Okay, do not touch the area. Now before I get my sterile gloves on, I want to flip my bio patch onto the site without touching it. Go ahead and good. All right, so then I am ready to put on the sterile gloves. Sanitize. It's very important also that I do not turn my back to my sterile field or my client. So I'm going to put the gloves over here so I can still be facing them. Okay, so I'm just going to pinch and up. Okay, and then I'm going to go in without using my thumb to get the other one on. Good. Okay, so sterile gloves are on. I'm going to keep them above my waist at all times. All right, so we are ready to clean the site. So I'm going to reach and grab my chlorhexidine. I'm going to crack. Okay, so we're going to do 30 seconds looking at my watch. And that will be, we'll do horizontal first. Okay, and then vertical. concentric circles. Okay, drop that. We want to give that time to dry, which is fine, because in the meantime I'm going to get my needle ready. So I'm actually going to use my non-dominant hand and not reach over my sterile field to pick up that syringe. Might get a little creative here. There we go. And then I'm going to put the needle in my hand, drop the cap, put that up there. Okay, now my non-dominant hand I'm going to use, make sure the site is dry. Okay, and we're going to tell them we're going to be a little pin, a little poke. There we go. Okay. So first thing we want to do is withdraw back to look for a blood return. So with this, we're having some technical difficulties with this today. I'm not getting a blood return, but in real life, if I was not getting a blood return with my client, I would have them cough, move their arm up and down, lift their arm above their head, maybe that would help. So let's say we do a blood return. I would go ahead and give the normal saline with a push-pause technique. And ask them how they're feeling. You're watching the site. If it were to be swollen, I would stop and notify the physician. But we're good, no swelling. Okay, so let's go ahead. We're going to clamp, remove the syringe, and alcohol. If we had site scrubs per the policy, I'd be using that right now, but we do not. So I'm going to use alcohol. And that'll be for 15 seconds using my watch. And using friction. Very important to clean the hub to prevent infection. Scrub the hub. Okay, 15 seconds has passed. And if I had a continuous line running, a heparin flush to do, a blood sample, I could do it at this time. I do not. It is locked per the order, which is lock the site. So I'm going to go ahead and put that down. All right, so now it's time to document. So I would document the date and the time, how the patient reacted, how they did. And then I would check the site. Site was good. If the biopatch is in place, which I will do now, and it's blue to the sky. Okay, I would do the gauge type of needle, and if there was good blood return, if it is a locked or running IV, and then what I flushed with and how much I used to flush. And then I would dispose, I would dress the site. So I have transparent dressing. I'm not going to put it on this for practice purposes, but I would put that on, and then if we had a shirt and pant, it's called dressing, I would apply that, making sure not to put it over the nipple and making sure that the tubing is in the notches. And then I would dispose per policy of my supplies. And that is it.